So I am Dr. Brianna Rhue. I'm honored to be here. I have a private practice in South Florida where I practice full family optometry, heavy into myopia management. And then I also co-founded Doctor Contact Lens, which helps doctors connect to their patients and keep them away from online. And I've been a huge fan of Weave. I actually started with a company called Demand Force in 2010. Actually, I was one of the first optometrists to use Demand Force because I went to a dentist, got reminded of my appointments, got reminded to leave a review, and went back to the practice I had just joined, and we were manually calling patients, confirming their appointments. And I said, there has to be a better way. And so they weren't even in optometry yet. So one thing to see is what other areas, what other verticals are your friends, and innovate with them alongside. So I've always looked to the dental space to see what they're doing. AI is really heavily being used there, and we'll go into some use cases here. But if you could put into the chat for me where you're coming from, and then also next to where you're coming from, if you could give yourself a score from 1 to 5 on where do you sit with AI? Are you using it daily or not at all? So not at all would be a 1, and daily would be a 5. And then we'll jump right into this presentation. Thank you. Niles, hi. Ohio. Caitlin. Anybody else? Houston. Using AI about a 2. Seattle 3. 5. Amazing. Eric, you could probably be given this, right? Okay, so we're going to jump right over here. All right. So AI in healthcare, what is it? What it isn't, and why it matters now. And so I get a lot of my knowledge not only from obviously owning a tech company, fast growth tech company, but just being curious. So if I can tell you anything that you're going to take away from this is just start to get curious. And what profession are you in? Are you a dentist? Are you an optometrist? Let's go ahead and put that into the chat. Dermatology, family medicine. What else do we have here? Love it. Optometrist. Hi guys. Dental, vet. So we can see that this will kind of all go across all of our businesses here. So I'm going to play a little video here for you to start. And this really put this into perspective. So I was listening to a rare.
What is it that you're doing at Amazon?
AI.
And this is one by
so
Jeff
I mean, there are a
Bezos.
few things, but it's small, but it's 95% AI.
And where do you
it's just so, because we're literally working on 1,000 applications internally. So AI, you have to remember, AI, modern AI, is a horizontal enabling layer. It can be used to improve everything. It will be in everything. This is most like electricity. These kind of horizontal layers, like electricity and compute and now artificial intelligence, they go everywhere. I guarantee you there is not a single application that you can think of that is not going to be made better by AI.
This was an interview he did in 2003, where he was really already into major programming and seeing where all this was going. So realize during the past 5 years, when obviously we went through the pandemic, really who of us was using telemedicine? Almost none. I'm telling you right now, my company would probably not be where it is if that hadn't happened. But it helped us speed up things to take our blind spots and really dive into them really deeply, really quickly. So I think that this is an opportunity more than ever. And all of you on here taking the time to go through it, let's just look back at what he means by horizontal. So AI isn't the future. We know that it's already woven into our daily lives. We're using it all the time through facial recognition. We've got now, we're using it in emails, online shopping. I used it this morning with voice to text and said, give me my top 3 takeaways from our staff meeting this morning. But if we look at what electricity was, and this is what Jeff Bezos was talking about, when electricity was invented, which happened to be the light bulb, people didn't ask to put electricity into their homes. They asked to put lighting in their houses. And what you will see right here, this, they didn't even have light switches then. It took them 20 years to get an adapter for a light switch. And then you had all of these industries where electricity horizontally spread out. That's what he means by AI moving horizontally. So it's not going to not touch anything and isn't already touching anything that we already do. So this is, again, what that quote is. So I don't care, again, if you're a vet, if you're an optometrist, if you are a dentist, right? We went to optometry school, we went to dental school, we went to vet school to become vets and dentists and optometrists and do really good things that are craft. First, take care of patients, first, do no harm, so we don't get sued, right? But we have to realize we're not optometrists, dentists, vets, family medicine people that happen to own a business. And by the way, the word small business, the definition of it is a company doing under $25 million in revenue. Does that sound small to you? No. So quit putting yourself in this box. One of my takeaways here is you are no longer, you're now a business owner that happens to do what you do, but you are now a tech company that performs what you do. Meaning, I am a tech company that provides eye care. I'm going to say it again. You are a tech company that provides dentistry. You are a tech company that provides veterinary medicine. You're a tech company that provides family medicine. So this brings me to that clinical mind versus our business mind. I'm going to say a bad word. We're all salespeople, okay? But this just comes with asking better questions. And again, that curiosity word. This is not a time to bury your head in the sand. If you feel like you're behind, you're not, because you're actually on here. You're showing a side of curiosity. That's why we went on to become doctors, is because we were curious. So that's where you lean into these things. But we were never taught how to really move our businesses forward. And we're going to move it forward by things with AI. What did we turn into in 2009 when we all had to go to electronic medical records? We all got, thousands of dollars to go clinically. Did you know in 2009, 9% of people were using electronic medical records? By 2014, in 5 years, so this is like 5-year stints, you're kind of seeing a pattern here, 90% of doctors' offices were using some form of an EMR. So talk about quick adoption. We're good at it. So you may feel like you're Fred Flintstone living in a Jetsons world, and that's okay, right? So instead of being data collectors, what a lot of us have become, right? Maybe you're paying a scribe to do all the data collecting for you, to come up with the diagnosis, and then have to explain that diagnosis to the patient. So some examples are like ChatGPT, diagnostic tools, and then that predictive analysis. So you can even see when you're going into some Zoom meetings or into Teams, it's asking you now if you're a robot. So one of the low-hanging fruit, if you're in a lot of meetings, get one of these, right? So it will transcribe all of your meetings, tell you your takeaways, tell you your to-dos, and now you have a note taker. That would have been fun in school to have a note taker. But let's clear up what it's not. So we see all these robots because we want to humanize it, okay? It does not think like us. We are not going to be replaced, but it is going to change how we work. 75% of AI companies are building in the healthcare space. So if that doesn't tell you what we're doing is broken or inefficient, I don't know what will. So that again, keep investing in yourself. I like to say I'm a multimillionaire with a minus in front of it, okay? Invested hundreds of thousands of dollars to buy a practice, and we have to keep it going. Our businesses 5 years ago aren't the same. Our businesses 10 years ago aren't the same, okay? So one thing I attribute a ton of my growth to is reading. Here's a podcast that I also have. So we review one business book a month. The book we're reading right now is Essentialism. And it talks a lot about focus. So in and on to the next world right now, it's going to take focus. So it brings me here to the process of change. I don't use the word change anymore. So as doctors, when you say the word change, it actually releases cortisol to your brain. When you say, let's say you go to a conference and you come back and you want to make all of these evolutions in your practice. If you say the word change, your team's like, screech, put on the brakes. No, I'm not doing it because this is the way that it's already been done. That does not work. That's not one of our core values in my practice. But if you use the word evolution, it actually releases dopamine to your brain. We're not the same 15 minutes ago than we are now. We are constantly evolving and evolving faster because we have really cool tools right at our fingertips. We have supercomputers in our back pocket at all times. So start to use it. So what happens is when we say change, right? We go into the resistance phase, we go into the chaotic phase, we try to climb ourselves back up. We transform the idea, integration happens, and then that becomes the status quo. So it's not replacing you. It's just amplifying what we do. Patients expect speed. They expect things on their own time. This helps us spend less time on tasks and more time with patients. Our exams are taking longer than ever because people are lonely. And they look to us as their primary care doctors. They want to talk to us. They don't want us to be typing on a screen. So where can you speed things up? We also want hyper-personalized care. And we want faster diagnoses and faster treatment. So what AI can help us do, again, enhance diagnoses, enhance treatments, those personalized treatment plans, optimize patient care. What if you could see 50 patients a day and make it felt like you saw 15? I'm in Fort Lauderdale. I'm in a 20 by 20 mile radius in Fort Lauderdale, okay? There are 450 optometrists in just my county. And we are booked up because I use tools like Weave. Get to 200 reviews over the summer. Set that as mission 1 right now. We can, again, optimize the patient care, optimize outcomes, improve workflows. Look at your workflows, right? Patients shouldn't have to wait 4 months to be seen. We need to recognize abnormalities faster before it becomes a problem, and then be able to analyze the data. So if you're like me, where sometimes you're like on to the next, throwing up these scripts, on to the next patient, on to the next post, on to the next day, okay? Give yourself to slow down. Are you giving your team the time to implement new things? So things like this are constantly adding up, especially in eye care. Vets, if you guys are selling dog food, cat food, prescriptions that you're prescribing, just like we do in eye care. If you're upselling treatments in a dental world, in family care, if you're getting into infusions and things like that. In my practice, it's every patient, every time, every encounter. I just ran my numbers and we look at our per doctor revenue per patient. I am triple what my associates are. But I'm only seeing patients about a day and a half a week because I'm giving myself time, obviously with Dr. Contact Lens, but other things. So let's look at just one patient walking a day. So again, we get to sell what we prescribe. One patient a day with 5,000 doctors working 3.5 days a week. Every prescription you let walk out of your door to us is worth about $300. There's $236 million if just one patient walks 3.5 days a week. There's real money. There's real leaky buckets in our practices. And this is, again, what AI is really good at. So we have to run smarter practices. We have to monetize our own data. Get involved with things like Weave, which is why you're here. See what they want you to be part of the build. I've been there. I've been in their product management meetings. They want your ideas, right? Because that's how they actually build new products, is us requesting things. That's why we build it Dr. Contact Lens. We do a big programming session, and then we actually do a RICE method. So the RICE method, we're looking at how it's going to impact our revenue, what impact it's going to have, the capacity that we have, and the ease of doing it. So here, for instance, predictive recall. Maybe I don't want to see that patient back because they've never spent any money with me. Push the visit out. You don't have to see all those patients. Make it your top priority. Mine is myopia management. Yours could be Invisalign, right? It could be look at your top 20 spenders, 20% of your spenders in your practice. Contact lens ordering automation, staff scheduling. So where is AI making a difference? In our field, it's OCT visual fields. In your guys's, it could be x-rays, right? Diabetic retinopathy, myopia risk prediction, medical record summarization, personalized treatment plans. Start with one workflow. So I had my office manager, we were looking at a different building company, and I give them full autonomy. If it's under $400 a month, just go, we'll figure it out. And we're gonna reevaluate it in 90 days if we're getting from it what we need. I don't know your job at this point. I'm not in the day in and the day out of checking in and checking benefits and what patients are calling. I've done that. I did it, I worked from patient to front desk, to scribe, to technician, to optician, to optometrist. But I did that a long time ago before we even had any of these things. Watch your front desk, what they are doing on a daily basis. Could you improve one workflow? Choose a tool that's going to fit your current process, then measure the time and the revenue that you gain, and stop being the bottleneck of your practice. I heard this the other day from my coach. He goes, I give everybody the autonomy, right? And I say to people, I need you guys to do your own self-development. You should be working on yourself more than really you're working in the practice. But what that is if you are looking to me as the owner or the optometrist or the whatever, for all of the answers, we are truly F. So everybody this has to be ingrained in your culture. You have to get your team involved. You have to stop being the bottleneck. I have everyone take a demo. If someone calls my practice and I heard that you said no to a potential $2 million opportunity sitting in my practice, because a lot of optometrists do that because I sell them every day, you didn't even take the demo. And I'm not saying you have to take every single demo, but as you go to the floor or to a major conference, go there with conviction. Go there with power, understanding that you are the shark in Shark Tank, as everybody's pitching you all the time as the doctor. That makes you the shark in Shark Tank. So act like one. Well, and here, your practice and your patients are ready for AI. So think of yourself as a consumer. Don't fear the change, lead it. Don't fear the evolution. I said the bad word, change. Identify one area of friction in your practice and ask, can AI help me here? Start prompting. Just start using ChatGPT or Claude. You are a master scheduler. Create a schedule to see 25 patients a day, where we take an hour for lunch, starting at 9 a.m. and being done by 4:30 p.m. to pick up my son. It's also fun when you start prompting it. I asked it to roast me the other day. That was an awesome prompt. And I'll go back to this slide, but ChatGPT, okay, it's more than just chat. So it took Spotify 11 years to get to 100 million users. It took ChatGPT 2 months to get to 100 million users. In 4 months, by February of 2023, they reached 1 billion users. So this is not a fad. I remember when Facebook was coming out. I just was in school in 2007, 2008 when Facebook launched. And I remember sitting there, and the first one of us that were on the bandwagon, right? Everybody was saying it was just a fad. It was just a fad. The internet wasn't a fad. Social media wasn't a fad. AI is not a fad. So how to evaluate it? Start by asking better questions instead of asking what things cost. When you're walking up to booths, they're there to serve you. Ask, what is the ROI? What is the investment? What does onboarding look like? What does customer support look like? Go easy on the bug, and be part of the build. If you're part of one of these EMR systems, ask your electronic medical records to start integrating with things. I had to beat on doors to get doctor contact lens integrated. It's not theirs to keep. So be part of it. So here's a takeaway. Just start. You're already ready. Just use it more to become efficient, effective, and enhance what you do. So this is an app that I've just started using. So it's called Coursive. And you can spend 10 to 15 minutes a day just using different tools. So it's kind of like the app that Duolingo, where you're trying to learn a different language. This is really just learning a different language. A lot of it is prompting. So your profession is counting on you. Please connect with me on LinkedIn. I am always your biggest cheerleader. As doctors, physicians, people that are helping your communities, they're counting on you. But they're counting on you to stay curious, drive your business, because if you don't have money in the bank, you can't serve your patients. So if you want a copy of the iPitch book, which is a workbook to help you understand more like Shark Tank, happy to send you a copy. Just again, message me on LinkedIn that you found me on the Weave webinar, and I'm happy to share my book with you and send you a free copy. So with that, I'm going to pass it over to Cassidy, but before she starts, there's two things I love with Weave. One is obviously this new AI call intelligence. I can see who is doing what in my practice, who's missing phone calls, who's dropping the ball sometimes, who's doing excellent, right? So we give out spiff awards. But the other thing is the missed call text. So more than ever, if you're spending all this money on SEO trying to get new patients in and you're missing phone calls, you have a 5% chance that that patient will call you back before they are on to the next. So the missed call text, sorry, missed your call. Need to make an appointment? Click here. Need to order your contacts? Click here. We live in a self-service environment. So these are items that Weave has really, really helped us with grow with us as a practice. So with that, let's put in the chat what your number one takeaway was, and we'll pass it to Cassidy.
All right. Okay, so I'll go ahead and share the Weave app here and just go through a couple of the ways that Weave currently today is utilizing AI and get your feedback there. So first place that I'm going to mention here is within our texting solution. So right here, right off the bat, what Dr. Rhue just was talking about, that missed call text. This is something, any call goes missed, patient hangs up before you guys answer the phone, whatever it may be. This is a message that we can automatically trigger and send to, said patient there. We do have a feature in here in Weave that is going to help you with tagging and notifying individuals of specific, responses back to messages, things like that. So if you see here, say I'm a patient, I called in, hung up, I received this text message here that says, hey, thank you for calling our office. Sorry we missed your call. Please text us back. Right there, just barely, I texted in and said, hey, I need to cancel my appointment. What had happened is Weave took AI, read that specific text message, and then automatically tagged it there, and then notified me, hey, you're somebody that needs to be notified of a cancellation. Here is that notification here. You need to go attend to this specific message. So that's kind of the first place that I'd like to highlight, kind of that AI feature that will kind of simplify, redundant tasks in the office for you. The next one is another one that Dr. Rhue also brought up about reviews. So Weave does have the ability to send out Google and Facebook reviews, also more to come on that. But the nice thing is we do have an integration directly with Google and Facebook. So We can interact with it whether we've solicited that review or whether, say, the patient goes directly to Google and leaves you guys a review. You will get a notification in Weave, and from there, we'll be able to also interact with it. So right here, Philip left me a good review here about my office. I do have the ability to click this little Weave assistant down here. Essentially, it's going to utilize AI to read what the patient had said in their review and then formulate a good response. So instead of, how many times can you say, awesome, we're happy you had a good visit, we value your business, before it just sounds like we're basically copy and pasting, right? So right here, we're able to utilize AI to respond to the patient. If we don't like what it said, we can shorten it. We can also edit this. You can add whatever you want to add to it. And then we are also able to submit that directly to Google and Facebook. So right then and there, it helps our scores. We're interacting with patients. And in the event, if we get a negative review or anything like that, it also does very well with those types of responses.
Cassidy, can I add one thing to the reviews?
Yeah, of course.
Don't be a gatekeeper of your reviews. So if you're nervous about reviews, what we do in team meetings, it's actually a really fun one. Go to the 4 practices that you're competing with in your practice, pull up their bad reviews and read them and see what people don't like about those other offices, and don't do that. But what we do in my practice is anybody at any time can be reviewed. Everybody sometimes has a bad day, and that's okay. But don't be a gatekeeper of your reviews, because that's what really, really puts you on the map. So just turn this feature on and get to 200 as fast as you can. Throw a QR code up there. Ask your team every time somebody gets a review, we're going to spiff you $5 or a $5 gift card, and keep them in your back and see your reviews skyrocket. But you have to ask for this in the beginning.
Yeah, honestly, I mean, just, personal experience here as a patient. If I do see somebody and they have like a straight 5 star rating, I feel like it's not real. But the nice thing is in the event that we do get negative reviews, we can use that AI response assistant and kind of address the issues. And that honestly goes a lot further for me, that the staff is actually owning up to it, kind of trying to fix the problem. So, but all right, so we'll kind of move on to the last, but definitely not least, AI feature here that Weave has to offer. This is what we call intelligence. So essentially it utilizes AI to scan all of the calls in and out of the office, and from there, give us a lot of relevant feedback. So right here, just kind of on this homepage, I'll just briefly, touch on a few things, and then we can do a little bit deeper dive into it. So here, if you see, I had 43 calls that were analyzed in my office. The first metric here that's going to give me is going to be essentially conversion rate. So on the call, did the patient say something that the staff could have scheduled an appointment, and did they schedule it or not? So right here, we already have a list of low-hanging fruit because we should have been able to schedule it, but we didn't. So let's go ahead and call this list back and get them on the schedule. We also will do specific things like follow-up tasks. So say the patient is, on the call, they say, hey, I need to get in. I see you guys are super booked, out for like a month. Can you add me to a wait list so I can get in as soon as possible? Or it could be something like, hey, I got my bill. Looks like something was up with the claim. Can you have somebody call me back to go through this? Things like that, right? So what was said on the call can then derive a follow-up task. And from there, we can go ahead and kind of work our way through them, complete tasks, show the progress of them, and also here track kind of how we're doing and our completion rate of specific tasks. We'll also break down calls by the category. So do they call for scheduling, emergencies, things like that? What types of appointments are they calling in about? And then last but not least, customer sentiment. So that really, really important thing there is that customer sentiment. Are our customers happy when they're calling us? So I'll just show kind of like a brief breakdown here. We are able to basically scan the calls, give you who was on the call with them from an employee standpoint, what type of patient called you. So was it a new patient or one that you guys have already seen before? Any follow-up tasks, that conversion rate there, that customer sentiment, things that were talked about. And then we do also provide you with a full summary of the call or a transcript. And in here is where you guys can also come in and see, like, where did we derive tasks, or where was, you know, something said in here where the customer was unhappy, things like that. So a full breakdown there. We can quickly communicate back with this patient if we need to. And at any point, if we feel like, hey, you know, maybe this analysis, maybe the patient was being sarcastic, right? They really weren't unhappy. Anytime that you guys run into anything like that, we do have the ability to adjust that and also save that analysis, helping the model a little bit more, kind of get the feel for how you guys operate. All of these things can be filtered. So you can also filter down all of the AI data here. So by office user, by conversion rate, you know, by customer sentiment, categories, marketing numbers, things like that. So tons and tons of filters in here to really see what we want to see within the call intelligence platform. So that's it from me on that currently, you know, kind of where we're at with that. There is a few other places that we do utilize utilize AI within Weave. Like our marketing tools, we do have a full email marketing AI-based campaign builder, and also more to come on the AI in the future. So, but feel free if you guys have any other questions, want to know a little bit more, you can always reach out to your account executive, and they can also, you know, give you some more information on that. So.
Well, some takeaways. I've been a Weave customer for a very long time. They're great to work with. The team, my staff always loves it. Voice messages are such a thing of the past. Like, don't call and leave me a message. So that's coming too, where it's going to show you the transcript of all these voice messages. But yeah, you guys have been incredible. So keep it up over at Weave. And then again, just get your hands dirty in all of this. You cannot mess up when it comes to AI. Just start prompting. You're already using it more than you know, and get your team involved. So have them do demos, have them understand the tools that they're using. So I know Carly, Cassidy, you guys have a bunch of trainings coming up over the next, so you guys are calling it spring training for Weave customers, because they've just launched their new version of it. So obviously Weave has gotten a big facelift, and it's just a pleasure to work with you guys all. So again, connect with me on LinkedIn. If you want your copy of the book, just message me and I'll get that out to you. And thank you all for attending on this awesome Tuesday. So with that, we'll let you have your rest of your night back and live your vision.
Yes, thanks so much, everybody. We hope today at least sparked some new ideas, gave you some tools you can use right away. We will send a follow-up email with resources, but we really appreciate your time. Thanks so much.
My pleasure.
All right.
Bye, guys.
Thanks, guys.